Hey, this is What the Flip, and I'm your host, Victor Vogel. And today we're covering the third session in the series on our healthcare system, the cost of that healthcare system, and what's going on with it. So, in the first two sessions, just to kind of catch you up, you can go back and see those videos by going to the Facebook address that's scrolling across the bottom here. And there's a video section in there that's set up as a series called Attack on America, the Healthcare War. So each of the videos previous to this, the two are in there already, and this one will be in there shortly after I'm done. So you can go back and recap or go back and think through things, however you want to look at them. Now, I think what I want to do here is just take a moment and say, in the first session, we covered how much healthcare was actually costing us. And it is costing us quite a bit of money. We talked about how much money was there from the standpoint of the GDP, the gross domestic product, and other things like that. So we have that available to us. We know what that information is. So those are pretty much hardcore facts pulled out of numbers. We then took a look at, okay, if we're spending that much, how are we faring on all this? What are we kind of getting for what we paid for? And there we looked at a comparison of us with the other countries in what's called the OECD, a grouping of international domestic or international democratic countries similar to ours, and from with averages on gross domestic product and everything, they can do comparable statistics. And there are also countries that support a free economy. So it's not like they don't have the opportunity in those countries not to have a capitalistic focused healthcare system versus, say, a government controlled or government run healthcare system. There's some things you need to kind of think about given what's going on right now in that environment, and that is that we hear a lot of talk about socialized medicine and how bad it is. The fact is, right now, the treatment, much of the treatment you're getting, if you're getting treatment for coronavirus, is being footed by the United States government. That is a socialistic program. Donald Trump's visit to the hospital, in fact, his whole job is socialistic in the truest sense of the term. And I have a whole series. You can go into one of the posts I had in my Facebook page here, and in that, at the bottom of that post is a link to a whole series of things I did on capitalism and socialism so people can understand it. But this idea, we're going to get into today a different kind of question. Now that we know where we stand, we will actually stand very low on the totem pole relative to how many people are covered, the kind of health care we're receiving. There were two measurements that were mentioned specifically, one from morbidity from birth. In other words, how long of a period of time will you live from birth till you die? And ours is shortened up compared to the other countries. So that's not a good thing. That's a bad thing. Shortening up means, or lesser of means bad things in terms of how long you're going to live. The other factor was childbirth deaths and dying in terms of childbirth. We are just really ranking horrible on those areas. Now, do a lot of people come to the United States to get special treatment for something? Yes, but they also go to Switzerland. They also go to other European countries for their specialty in terms of what they're doing. So overall, what we're talking about is for the cost we're paying, which is extremely higher, and we saw relative to the government versus the uh, sort of the public or the private sector uh, payments that relative to how much each of those governments are spending on a percentage wise of what they take in, the United States is pretty comparable with them. Where we fall off the mark is where us, the private sector, and begin to pay so much more out of our pockets for it that they don't have to pay. And so you have to wonder, how can they do that? How can a government-run healthcare system actually provide equal, if not better, care? And virtually the private sector is not paying anything for. And you don't have people bailing out of these countries. They're not running from these countries. In fact, these countries are actually shown to be some of the best places to live in the world. So we saw that. So we saw that kind of comparison. And then we saw the financial comparison of us against them and the spending factors associated with that and how we rated in that arena. And so what happens is we're spending a lot of money. We're not ranking great in terms of healthcare in the world. And so the question becomes, where is this money being spent that we're spending so much more of? And everybody has an idea of what they think that is, and they're pushing their agendas. But when you break down this information, this comes from the Brookings Institute. It's a research company that's been in existence since 1916. They do primarily research on how government stuff works. And consequently, they have to do some tallying of the private sector too. We begin tonight to look at, okay, how is this money, how's the pie carved up, so to speak? So that's kind of what we want to get around to today. So I'm going to launch into this. Hopefully this will not take as long as the previous two, because there was a lot of information I was putting in there to kind of help you understand, that we have spent a lot of money and we didn't rank real high. So let's get started with this. Where is this money being spent? Why is it being spent? Where is it being? What's causing this more enormous cost of healthcare for, at or lesser result of healthcare product for us? And so roughly a third of all healthcare spending goes to hospital care. Okay. And you go, well, I've never been in a hospital. But the fact is, there are many people who have. And so whatever that cost is, if you haven't been to a hospital, you're not costing us anything in the healthcare system, except your insurance premiums. Okay. Or if you're in Medicare like I am, then you're covered, and the government's footing that bill. So which is comparable with those other countries. But if you're paying for this and you're not in Medicare, you are paying a lot more than other people in other countries are paying for health care. Trust me. Or go back and look at session 2. Okay, so it's talking about, let me put up a chart here. So while I'm talking to you about this, you can see what's going on with this. Okay, so you might find this a little difficult, I'm not sure, but to read, but we'll kind of cover it and you'll get the gist of it. Roughly a third of the healthcare spending goes to hospital care. That's this section right over here. And that's, making it clear. It's making it clear that the functioning of the U.S. hospital system is crucial to the healthcare system, and it's also expensive. If we didn't have those hospitals and we didn't have the surgery and we didn't have the ability to go through them, our mortality rate would be even less than it is right now. So hospitals, that whole hospital system is crucial, 33% of all of the cost. And that includes a large portion of what you pay out of your pocket goes into this hospitalization that people are paying when they're paying health care costs. Now, if you never paid into Medicare, you never worked and never paid Social Security, you didn't draw a dime from Medicare, and you never went into the hospital, and you never had to buy a drug, and you died in those circumstances, then you are not contributing to the healthcare system. So, I can't see you all, but if you raise your hand, how many have ever been in that situation? I think that's going to be a very minuscule amount of people in this country. So we know this is important. That's something that's critical for us. Is the healthcare system is important to us. The hospitalization system. So within that, professional services make up roughly a quarter. That's this purple range right here. A quarter of all of that money. And you have to go back into the first session. It's like 25% of our budget in the country. So that's a lot of money. Professional services make up roughly a quarter of the spending. So between hospitals and professional services, we spend probably around 58% of the money we spend on healthcare is in these two areas, professional services and hospitalization, the actual hospital environment world. Professional services really are those that are provided by physicians and non-physicians outside of the hospital setting, including things like eye care and dental care and other services like that outside of that world that deal with actually working on your health, like pulling your teeth or putting glasses on you, whatever that is, and or the surgeries or the things, your annual physical and all that kind of stuff. So those professional services and hospitalizations obviously are very, very important, over half of what we spend money on in that arena. The combination of long-term care, nursing care facilities, nursing coming to your home, etc., and home health care accounts for about 13% of the total health expenditure. So, and this is primarily impacted by the age group that we saw that spends so much money, much more money than the younger individuals. The older you are, you need help, you need assistance, and families aren't always there or able to provide that. So you go into a home, you receive health care in that home, or people come to your home and take care of you there. So that accounts for about 13% of the total healthcare expenditures. So that's not a lot of money when you think about the overall cost. It's a lot of money to us, but in the gist of the scheme, it's only about 13%. And here's what I found interesting, because everybody's screaming about drug prices. Prescription drugs are next at only 9%. Only 9% of the whole healthcare cost system. And the net health insurance cost, premiums earned less benefits paid. So all the premiums you pay and then the benefits that people pay, and they subtract that from what they get in from all the enrollees in their healthcare system, then that accounts for about 7% 7% of all the money that's spent on healthcare. So your premiums, and I keep harping on this, keep going up. They have been going up and going up and going up. And that in itself creates a expensive situation for people who are paying for private insurance. And it's not so much that it's a large portion of all of the healthcare expenses spent, but that portion is one reason why we rank so much higher in cost to other countries, because we, well, not me now, but you, if you're working and have to provide your own private health insurance, that cost is skyrocketing and has ever since I have been in those programs for, it was 20, 25 years that I was in those programs. Every year the healthcare cost went up to me, and they maneuvered it and they talked about this and they talked about that. And I know because I used to write those programs and plans as part of my profession. And you're told this and you're told that, and how much better off you are. So, but you never really understood it. But the net effect is the net coming out of your checkup going up nearly every year, and that's pretty consistent for everybody. So prescription drugs are 9%. Net health insurance costs are at about 7%. So insurance covers the difference. Insurance covers these different expenditures to varying degrees. So, if you pay the insurance company a premium, you may pay less for hospital rooms and certain things, and that kind of depends on your deductible and all that. We'll get into that later down the line, but it's one of those dynamics we have that a lot of other countries don't have. But insurance covers the difference between those costs that you have and what you pay them to cover. So consequently, out-of-pocket spending looks somewhat different than overall spending. Okay, the largest shares of out-of-pocket spending go to the professional services. So when you pay for insurance, the vast majority of that's going to the doctor, or it's going, your personal doctor, or if you go to a specialist, there very little bit of that, unless you have a major incident like I did with a hip replacement. Very little of that goes to the hospital, and I went 72 years, 72 years before I ever entered a hospital, and that was the first time. So obviously, all of my expenses were not spent on the hospital side, it was spent on the professional services side. And by the way, it was very, very little, because I virtually never went to the doctor, maybe for the flu, and then, the health insurance portion covered that. So your out-of-pocket expenses normally go to the professional services, not the hospital services that have those large bills, unless you have a major incident that goes along with that. So, because prescription drugs are an ongoing expense, though, for many people, and given the immediate and direct health impact, in other words, if you don't have your drugs, your blood pressure can go out of sight, or perhaps your diabetes will run rampant, or maybe there's other medicines that are cancer-based or whatever, that you could literally die if you don't take this medication. Because of that impact, the cost of prescription drugs really becomes the dominant healthcare cost discussion out there. And yet it's only not like 9% of the overall cost, but because of the impact of it, and the idea that there is a large portion of the population that can't afford $15 for drugs. let alone the $75 to $125 or $225 for some shots or whatever that are unique, like scabies shots or things like that. Uh, they're very expensive, and some people just don't get them and just gamble they won't get this. And, you know, because it costs so much money. However, just sometimes that $15 is maybe would be 30 or 35 if you're on private insurance, for example, and not covered by a major insurance company. Um, that those expenses may be beyond your reach. So that impact is why people say, hey, we got to bring the drug prices down so people can take a breath and know they can at least get their medications. Whether they have to go in now, it's almost like it works like this. They almost think, okay, I can go out here, fall, break my hip, and I know I'm going into the doc. I know I'm going into a hospital. I'm going to get all these x-rays, and nobody's worrying about anything except getting me in the hospital, diagnosed, getting the surgery done, get me recuperating, me feeling better. It's after all that's over that the financial burden really drops like a rock on you. But they kind of know they're going to get treated okay, even if they don't have insurance. They're not going to turn you away. They're just not going to do that. So that's they don't talk about hospitalization costs as much because people can't pay for the hospital. They talk more along the lines of this drug cost because everybody's impacted by that, and it's very crucial to everybody who has to take medication. So but for individuals and especially for the system as a whole, the expense of professional services is actually a lot larger than prescription drug costs. The idea of how much a doctor charges or how much labs charge you or things like this and go into that, right? So I talked about, I think in the second session, the doctor that was out of network but worked in an in-network hospital in the emergency room. Then I went in, sent me a bill outside of my insurance for $1,500. We got that solved, but but $1,500 for the 5 minutes she spent with me. You have to ask some questions about a couple of things. Why did we need to pay that? Then secondly, we need to ask, why were you negotiated down from $1,500 to $400 that the insurance Medicare was going to pay you? And $400 for 5 minutes still is, you can have a nice home in Mercedes and travel and have second homes and all that for that kind of hourly rate. So it's not like there. So don't ever get fearful that if you went into a system run by the government, that all your doctors are going to leave because they're still making tons of money and they're not going to give up. They don't know what else they would do if everybody had to do it. If it was across the board and everybody had to do it, doctors are not going to bail in this country because there's nowhere else that does private work. All the other countries would be where we would be then. And then secondly, they're still making tons of money. And it's guaranteed money. They don't have to go find it. They don't have to worry about whether you're going to pay it. So that's why they negotiate it down. So these are things you need to kind of understand about your healthcare system so that you're not fearful or you're not bullied into being fearful about, this is so bad, it's socialistic. Well, first find out what socialism really is before you start, throwing it in the garbage can because you've had it for years and years and years. And if you've been on Medicare, you've had it for years and years and years. So much of the health spending actually consists of labor costs rather than capital investment. So we're not talking about a lot of new fantastic surgical equipment. We're not talking about new and fancy hospitals, etc. Although those are expensive, the vast majority of the cost is associated with labor costs. That's a variety of things, that have to do with the people. So one study of physicians' offices, hospitals, and outpatient care centers found that labor compensation accounted for about 49.8% of the 2012 total healthcare revenues. Excuse me, I get some water here. 49%, half of what we bring in from healthcare is paid to, compensation. And that's, their benefits is figured in and all that. But the average company is probably in the neighborhood of 35% in a lot of cases. But what makes this difficult is, who we have in that labor, doctors, physicians, and nearly everybody touches you as an expert. So that's those people are not, they've paid a lot of money. They go to school and learn how to do these things, so they expect a return on their investment. So if we were going to do something about that aspect of hospitalizations cost, it would be lowering the labor cost. We'd have to figure out how to reduce that. Some combination of labor supply, like more healthcare, more healthcare for professionals in the market, would create, if you had a labor market that was flooded with healthcare people, you would have a lot of choice, and consequently, you could offer less money to different people. When you have very few people in a particular industry to draw from, you have to normally raise your wages and cost to acquire those people. So that's one thing. There's also fewer restrictions, and you would also have to ensure that to do that, to move out of that, because these people command higher prices because they're expected to do more things than their average. For example, fewer restrictions on what non-physicians are permitted to do would have to happen if you wanted to lower labor costs and pay people less for what they do. Then you can't expect them to take the responsibilities off the doctors who they're paying more for. And we're kind of going in the opposite direction of that. We were going in the idea of nurse practitioners, which is I will see you instead of the doctor. And so they are actually commanding a little more money for that. And we would have to begin to talk about it. Is that really a cost-effective way of running a hospital system? And reductions in unnecessary services. And we could go on and on about, you need to get a test for everything. I think you might have blood clots. So we're going to run you through an $800,000, maybe $3,000 test because you got insurance and it covers it, because you make sure. And that's making you feel good, but as long as if somebody said to you, hey, look, you got to pay $5,000 for the test. I don't think you do, but I just want to be sure. You could see how that discussion would go. So, and generally speaking, what's going on here is the way hospitals are run. Oftentimes, those kind of unnecessary services happen to generate revenue, not necessarily based on really concern for your health, as much as it is they can use that as a leverage, if you have insurance, as a leverage to generate more revenue for running that hospital. And we can get into that down the road too, and talk about how hospitals are actually being run. So that's kind of how your money is being spent, in summary, the largest cost of healthcare is how hospitals operate and the labor cost associated with providing those services. And that's a big part of it. And it's also the professional services out there. Once you get past that, the home health care, the home centers, the pharmaceutical companies, the prescription costs and those kinds of things aren't near as expensive as most people are led to believe by everybody's jumping their hoops saying we're going to cut prescription costs. So, well, that's not where the biggest cost in hospitals is, folks. It's in these hospitals and how they're run and the professional services and the cost that we've created by elevating a whole variety of people to do more responsible things that doctors used to do back in the 50s, 40s, and 50s. They're now being handled by nurses. So, but they have to give them more training. They have to feel comfortable with them. It's not like your life is in jeopardy because of that. It's just that we're spreading that cost out over a whole lot more people. And so that reduces that. So you kind of get an idea of what's going on. There's a lot more to come in the next few sessions about hospitals and how they operate, how doctors and everybody are impacted by how hospitals are building as conglomerate corporations, about the whole concept of specialized situations where trauma centers and other major hospitals are located in much more populous areas, and more of the specialty groups are moving to populous areas for marketing purposes, because that's where the money is. And consequently, the rural communities are now suffering a lot more because of that. So some of that we'll be talking about down the road too. So you want to pay real close attention and stay with us. So I hope this has been informative. I hope you're now beginning to get a glimpse into our healthcare system and why it is so screwed up and why we're so far behind all these other countries out there that have taken a different tact in managing this whole system. So if you have questions, I want you to go ahead and put them into the comment section of any of these, or if you have comments about any of this, put them in the sections that are comment section, and I'll try to get to them and either respond to them, or maybe I'll throw some of them up in the air one evening. And we can talk. If you'd like to jump on the air with me, you can go to that link that I had on the air earlier. Let's see if I can find it for you. There you go. What the Flip Podcast, facebook.com, What the Flip Podcast. And there's a button in there you can hit to message me. And you can say, hey, look, I'd like to be on the air with you and just kind of talk about some of the things that have impacted me or whatever, and as we've gone along, and then I'll get back with you and we can discuss maybe you joining me live on the air, and that would be really nice to get other people engaged in discussing. I'm really interested in how, if you're knowing about this stuff, how you have been impacted. I know I have personally been impacted by this. And that's why I started looking into it. And I think if other people did, the stories would come flowing out of the woodwork and out of the walls. And that's what our government needs to hear. Who's ever's in office. So that's what they need to hear, so they know what the real problems are, so they can begin to address it, because they know we know what the real problems are, and it's pretty well proven in whether you're trying to change for whatever reason from one party to the next. It's pretty evident people have an impact. We have an impact. The more we know, the more impactful we'll be. So I kind of wanted to make sure that everybody has an opportunity to learn about the healthcare system in general. So that, I think, is important for us. So till next time, which will be Wednesday night, I'll put an event up in the event section, and the topic will be up. You can certainly come join us. I'm looking at, let's see if I go here and see, I didn't see any comments put in, so I don't even know how many people are watching this. A lot of people watch them after I do them, unless I have a guest. If you're in the healthcare industry, whether you're a nurse or a doctor or a technician or ambulance driver, whatever it is, and you'd like to join me and talk about, how you feel like you're being impacted about how we're operating this healthcare system, I'd love to hear that too. So just, again, go to this website, What the Flip Podcast, message me, and I will get back with you, and we can get on the phone and talk, or email, or go live with each other and talk, and get a sense of what we might want to cover for a session or so. And maybe that would be a nice break in between all this dry data stuff. So, anyway, have a safe day and the rest of the week. I want you to please wear your mask. There is nothing wrong with wearing a mask. It is definitely, and has been proven to be, the thing. We're so close. We have vaccines now that 90 and 95% for both the companies. That's close. But if we don't try to curb the spread of this, when they roll out those vaccines, it's going to be 5 times harder to get them out and get them effective and get everybody covered, so we can go back to normal, to opening things up and go back to a normal life. If we don't try to flatten this curve and put it on the downside before those vaccines hit. The less people we have in the hospital, the faster we will get everybody vaccinated and get through. And so that's not a lot to ask, is to wear a mask, stay social distance just for a couple of more months, until we can get everything on the downturn, and at least set us up in January, February, March for being able to roll everything out well and make it happen well, so we can all get back to a normal situation. I'm Vic Vogel. This is What the Flip Podcast. Oh, tomorrow night, if you're a senior and you're watching this, or you happen to see it, I'm doing a segment for about a half hour on Tuesday night, starting, I think it's 9:30, maybe a little late, but it's Eastern time, so it could be 8:30, 7:30, 6:30, like that. And really what I'd like to do is just get anybody who would like to join me to come on and just talk about how you're doing. There's so many things as a senior that I'm learning now that are interesting. I'm impacted by things I haven't been in the past, so I'm more aware of them now. I'm actually a minority, and I never grew up with that. I had a lot of privilege in my life, so. And I don't mean financial privilege necessarily, but I had some privileges I was unaware of that I didn't think about in terms of when I thought about older folks, and like, hey, okay, we're young, we can go out and have drinks, and it's not going to kill us, so you just stay home. Well, that's kind of like a death sentence to a senior citizen. So. Or a long-term jail sentence. So I probably would have been saying, I'm not mad, and I probably would have been saying the same thing at their age. That's what I realize now. It'd be nice if they could wake up more than we did in our generation. So have a good evening. I will see you Wednesday night. Be here. It's going to be fun. You're going to learn a lot more. Catch you later.